I'm going to talk about what is the difference between speech and language. So speech means it is the physical production of sounds. For example, we'll ask the child to say that is the physical production. So and also what is language? Language means it gives meaning to by talking. It passes the meaning by talking. That is language. So now I'm going to talk about what are the importance of speech therapy. Bobby wants to listen. So first, speech therapy. The speech therapy improves the communication. Bobby.
No, I think you ordered that place, no?
Which one?
This place and all you cleaned up. No?
I
So he had the pattern, no? So he disturbed the pattern. No? Bobby, come. I just keep phone sometimes. Bobby, no. That's a good
Okay, yeah. Okay, communication is an important aspect of life that we actually, we passes our ideas, we passes our thoughts to communication. So if the child is not able to communicate properly, so we need to get back to as soon as possible speech language pathologist. So when we need to go to speech language pathologist and like how fast we can go to speech language pathologist. So that's when it comes the critical age. So see, the research says that 0 to 3 years it's a critical age for the children where the rapid brain connection will happen and they can able to pick things faster in that brain development will be very rapid during that critical age. So that's why if the child is not able to communicate properly in that time, if you get the child during that critical age to the speech language pathologist, they will pick it very rapidly. So the improvement and prognosis will be better. So that's why we say that we have to get the child during the critical. That is why it is very important. The critical age is very important. So then how you will understand the speech is delayed? So how you will understand? So there will be a gross milestone where you will understand how the speech is delayed and when you have to get the child. So the gross milestone means by 0 to 6 months the child should able to say e, oo and babbling, and by 9 months the child should able to make a meaningless sentence like utterances, that is called jargon, by 9 months. And by 1 year, the child should able to say meaningful first word. By 2 years, the child should able to combine two words for communication. And by 3 years, the child should able to use 3-word sentences for communication. By 5th year, the child should able to make the long utterances and with proper grammar and the clarity. If these milestones are affected in them, so that time I think the parents has to be alert and then they have to go to speech language pathologist. So these are the things. And if you come to speech language pathologist, we will do a detailed evaluation, and also we'll understand after doing the evaluation, we'll understand what is the child understanding age and also the child receptive age, expressive age, and then we'll build up the goals and we will work on it. So when you come to the speech language pathologist, what is the benefits? So first thing is we helps in communicating better, not only in the verbal way, we help in we use gestures, we use picture communication, and also we use high-tech devices like app, AAC methods, basically that we use. It helps in them to communicate and their life will be meaningful and the quality of life will be better. And also we help in communication so that many of the behavior issues will come down, because some child they were not able to communicate properly and the other person is not able to understand them, they get frustrated more. So we'll teach them how to communicate so that their frustration will come down, so that the few of the behavior issues will calm down. That is one thing. And also the second thing, the speech and language therapy will improve their pragmatic and social skills. So we also work on the social skills, that is like turn taking, requesting, greeting, turn taking, conversation with other peers. So what will happen when we do that? Because usually these kids they will be having difficulty in communicating, difficulty in mingling with peers. So this, we will build these skills so it will help them to build a stronger, good relationship with their peers. The friendship will build. So so they'll be confident. This will help you in social skills. And also next, the other thing is, and also we work on the clarity. So most of our kids, even though they speak in the sentences or even though they speak in 2 words, their clarity is not very good. So they are not able to produce sound properly. The other person is not able to understand what they are speaking. So we actually assess which sound is error in the particular child. We work on the single sound, so that by then when we do that, so that the clarity of the speech, it will come. So the other person can understand it easily. And also not only the speech therapy helps them to understand others better. So not only we work on the expressive language, we work on their understanding also. So because they'll be having difficulty, they'll get confused with so many verbal cues and so many visual cues. So we will break it, we will make them very simple. We use simple cues or simple one-word utterances for them to understand. So we will build their understanding skills also. If you come to speak, these are all the advantage or importance of the speech therapy. So next I'm going to tell. So what are the placement of the sounds? The first placement of the sound. So the first is, we will always, the speech therapist, work on the vowels first. A, E, U. Why we work on the vowels first? Because the vowels are the sounds which will be developed first in them. So by 6 months only, the child should be able to produce A, E, U vowel sound. So that is why we practice that first, because it will be easy for them to produce. We can show visually, we can by touch also, we can give a clue for them. So first for our sound, how we will introduce our sound. Okay. So first we need to keep the index and the index, the thumb and the index finger, and we have to open them up. This way, that is the placement, how you have to make them produce out. And then the second is E. You have to use both index and the thumb, and you have to retract your leg. E. Okay? Then for U sound, you can do either this way, U, or you can do protrude the leg. This is the placement, how we do it. And next we work on bilabials. Means bilabials is per, ver, and ba. That will be bilabials are how it is produced means by closing of the lip at the level of the lip. Pa, ba, ma. So pa, ba, ma. Okay, this is how we differentiate the sounds, because all 3 sounds are produced at the same level. The child might be get confused, so we can use the cue for pa, ba, and ma. Okay, and next we can walk. And next, how to place and some of the sounds we need to keep the tongue, which is behind the teeth. Like the sounds are na, da, la, sa, and za. So these are the sounds we will keep the tongue behind the teeth. Na, da, da. So if the child is not able to produce these sounds, we ask the child to keep the tongue behind the teeth, either by placing the tongue depressor, by giving this kind of tactile cues, or by placing if the child is not biting or any issue, then we can just use our finger and we can just give them the tactile cue also. So this way we will teach alveolar sound. And the next is palatal sound. There is one more palatal sound, that is j. That is, we have to keep the tongue on the palate and we have to j. We have to. And next is last one is velar. The velar sound means the k and g sounds. How it is produced means you have to lift the back of the tongue, then the velar sound will be produced. That is little difficult, tricky for that, but yeah, we will just give the k and g. Okay. So this is how we produce. So we can't teach all these sounds at once for the child. We need to understand at what age which sound will develop. So by 6 months, the child should be able to produce a sound. So if the child is 2 years, he is not producing any sounds, we can teach him A, E first. So we can't tell the 2-year-old child to produce t and d sound because the oral structures are not ready for the production of those sounds. So we need to understand which sound when we need to tell them or teach them. So by 3 to 4 years, the child should be able to tell p, b, m, w, h, d, k, g, f, y. These sounds by 3 to 4 years it should be achieved. By 5 to 8 years, the child will achieve t, r, l, k, sh, ch, and ma. So these are the sounds. By I think after 8 years, all the sounds should be proper. If the child is not able to produce these sounds, then we will work on it. So this is regarding the placement of the sound. Thank you. If you have any